Hello everyone, welcome to part 6 of this series. Let's start with our learning tip. Pay close attention to the specific contraindications and concentration for special population, example, cancer, pediatric, geriatric, as this often involves unique physiological response and safety protocols. Also, note the integration of emerging technologies like AI and wearable in electrotherapy. Now let's move to question number 126. For breast cancer related lymphedema, which statement regarding electrical stimulation is most accurate? Option A. ES, particularly high intensity modality, is generally considered a first line of treatment. Option B. ES is absolutely contraindicated due to high risk of worsening the fluid accumulation. Option C. The low frequency neuromuscular electrical stimulation can be used cautiously as an adjunct to enhance the muscle pump. Option D. Only ES modality that induce a strong thermal effect are beneficial for lymphedema. And answer is Option C. A low frequency neuromuscular electrical stimulation can be used cautiously as an adjunct to enhance the muscle pump. Now let's move to question number 127. Electrotherapy over bony metastasis require absolute avoidance of Option A. Microcurrent therapy. Option B. Thermal modality. Option C. Iontophoresis. Option D. Burst stents. And the answer is Option B. Thermal modalities. Now let's move to question number 128. Which of the following statements about the application of therapeutic ultrasound is true? Option A. It should be applied over the areas of active bone growth in children. Option B. It can be applied over pacemakers if the intensity is kept low. Option C. It requires a coupling medium to effectively transmit the sound waves into the tissue. Option D. It produces electrical current that stimulate the muscles. And the answer is Option C. It requires a coupling media to effectively transmit the sound waves into the tissue. Now let's move to question number 129. Informed consent of NMES must include Option A. Guarantee of strength gain. Option B. Alternative exercise options. Option C. Device brand superiority. Option D. Cost comparison with surgery. And the answer is Option B. Alternative exercise options. Now let's move to question number 130. In Duchenne's muscular dystrophy, NMES aims to Option A. Maximize the muscle hypertrophy. Option B. Replace standing frame. Option C. Induce forceful eccentric contraction. Option D. Prevent contracture via low intensity stimulation. And the answer is Option D. Prevent contracture via low intensity stimulation. Now let's move to question number 131. For a 7-year-old with cerebral palsy, ES electrode placement violates safety if Option A. Over the quadriceps during the gait training. Option B. Within 3 cm of the femoral growth plate. Option C. Paired with angle foot orthosis. Option D. Using hydrogel electrode. And answer is Option B. Within 3 cm of femoral growth plate. Now let's move to question number 132. A smartwatch integrated TENS system is for migraine users. Option A. EEG triggered stimulation. Option B. Photophobic response sensors. Option C. Galvanic skin response feedback. Option D. GPS based location tracking. And the answer is Option C. Galvanic skin response feedback. Now let's move to question number 133. Tele-rehab electrotherapy fails if Option A. Patient cannot self-palpate the motor points. Option B. Video resolution is 180p. Option C. Real-time current adjustment is unavailable. Option D. Treatment logs are automated. And the answer is Option A. Patient cannot self-palpate the motor points. Now let's move to question number 134. PEMF for thumb-based OA reduce pain by Option A. Heating carpo-metacarpal joint. Option B. Inhibiting subchondral bone nociceptors. Option C. Increasing the synovial fluid production. Option D. Inducing the muscle atrophy. And the answer is Option B. Inhibiting subchondral bone nociceptors. Now let's move to question number 135. In elderly patients with carpal tunnel syndrome, preferred electrotherapy is Option A. Russian current over the thenar eminence. Option B. Interferential therapy at 100 Hz. Option C. High volt pulsed current. Option D. Iontophoresis with dexamethasone. And the answer is Option D. Iontophoresis with dexamethasone. Now let's move to question number 136. For acute hamstring strain in a sprinter, the optimal electrotherapy modality to accelerate early healing is option A, high frequency TENS, option B, pulsed ultrasound, option C, Russian current stimulation, option D, ionophores with ketoprofen. And the answer is option B, pulsed ultrasound. Now let's move to question number 137. In rotator cuff tendinopathy for overhead athletes, NMES combined with eccentric throwers exercise primarily target option A, supraspinatus tendon vascularization, option B, subthoracic rhythm mobilization, option C, posterior capsular flexibility, option D, serratus anterior endurance. And the answer is option A, supraspinatus tendon vascularization. Now let's move to question number 138. For areflexic bladder in spinal cord injury S3 S4 level, electrical stimulation aims to option A, inhibit detrusor overactivity, option B, trigger maturation via sacral root stimulation, option C, reflex external urethral sphincter, option D, enhance bladder wall sensitivity. And the answer is option B, trigger maturation via sacral root stimulation. Now let's move to question number 139. Transcutaneous tibial nerve stimulation. For neurogenic detrusor overactivity should avoid option A, 10 Hz frequency, option B, medial malleolar electrode placement, option C, bilateral simultaneous stimulation, option D, 200 milliseconds pulse duration. And the answer is option C, bilateral simultaneous stimulation. Now let's move to question number 140. For post-COVID orthostatic tachycardia syndrome, calf muscle NMES is applied to option A, augment venous return during the standing, option B, reduce the sympathetic outflow, option C, increase vagal tone, option D, prevent muscle atrophy. And the answer is option A, augment venous return during standing. Now let's move to question number 141. In post-COVID myalgic encephalomyelitis, microcurrent therapy avoids frequency greater than 5 Hz to prevent option A, mitochondrial oxidative stress, option B, lactic acid accumulation, option C, sleep disturbance, option D, autonomic dysregulation. And the answer is option A, mitochondrial oxidative stress. Now let's move to question number 142. An AI algorithm adjusting NMES for stroke gate rehab uses initial sensors to option A, synchronize quadriceps stimulation with heel strike, option B, modulate the intensity based on spasticity score, option C, predict fatigue from EMG frequency shift, option D, disable stimulation during stumbling. And the answer is option A, synchronize quadriceps stimulation with heel strike. Now let's move to question number 143. Machine learning for personalized stents in fibromyalgia prioritize. Option A, EEG alpha wave entertainment, option B, heart rate variability biofeedback, option C, skin conductance pain prediction, option D, weather dependent parameter shifts. And the answer is option C, skin conductance pain prediction. Now let's move to question number 144. For burn scar contracture, combined HVPC plus silicone sheeting improves pliability by option A, reducing TGF-beta1 cytokine expression, option B, enhancing collagenase activity, option C, blocking nociceptive C fibers, option D, increasing subdermal temperature. And the answer is option A, reducing TGF-beta1 cytokine expression. Now let's move to question number 145. Which type of electrical current is characterized by a continuous unidirectional flow of electrons for at least 1 second, resulting in net charge accumulation in tissues? Option A, alternating current, option B, pulsed current, option C, direct current, option D, interferential current. And the answer is option C, direct current. Now let's move to question number 146. When applying the therapeutic ultrasound for superficial tissue like carpal tunnel syndrome, which frequency is generally preferred? Option A, 1 MHz, option B, 3 MHz, option C, 5 MHz, option D, 0.5 MHz. And the answer is option B, 3 MHz. Now let's move to question number 147. Which of the following condition is an absolute contraindication for the application of therapeutic heat? Option A, chronic low back pain. Option B, muscle spasm. Option C, acute inflammation with active bleeding. Option D, stiff joint. And answer is option C, acute inflammation with active bleeding. Now let's move to question number 148. In the context of muscle re-education following prolonged immobilization, which NMES parameter is crucial to ensure the patient comfort while still eliciting a functional contraction? Option A, high frequency. Option B, long pulse duration. Option C, low duty cycle. Option D, gradual ramp time. And answer is option D, gradual ramp time. Now let's move to question number 149. Which electrotherapy modality primarily uses two medium frequency current to create an interfering beat frequency within the tissue for deeper penetration and pain modulation? Option A, interferential current. Option B, Russian current. Option C, high voltage pulse current. Option D, microcurrent electrical neuromuscular stimulation. And the answer is option A, interferential current. Now let's move to question number 150. For a patient with chronic, non-healing venous stasis ulcer, which polarity of high volt pulsed current is often used to promote granulation and epithelialization in later stage of wound healing? Option A, negative polarity. Option B, positive polarity. Option C, alternating polarity. Option D, biphasic polarity. And the answer is option B, positive polarity. So that's all for today. If you have any doubts, please do mention in the comment box. I'll be back with the next part in the next week. By the time, if you have any doubts, please do mention in the comment box. I have given the concise explanation in the description box and detailed explanation inside our Telegram channel. Please do read it, and all the best for your exams. And bye bye. Thank you.